Hello, gentlemen. If you are 65 years of age or older and have noticed that your intimate moments feel different, specifically, if you experience all the sensations of pleasure, that moment of orgasm, but without the expected presence of seminal fluid, then this message is absolutely essential for you. Perhaps this has happened just once, instantly causing you concern. Or maybe it's a quiet problem you've kept to yourself, experiencing feelings of shame or a silent fear about what it might mean for your health. I'm Dr. James, a urologist with 30 years of experience, focused on men's health at all life stages. Today, I want to have a serious, yet deeply supportive conversation with you. First and foremost, I want you to know that I understand your concern. The changes you are noticing in your body are not a sign that your masculinity has expired or that your intimate life is over. Think of it this way. This isn't a malfunction. It's a detailed message your body is sending, and that message simply needs to be decoded. Stay with me, because in the next few minutes, we will explore the surprising causes, critical red flags, and, more importantly, clear and manageable solutions that modern medicine offers to restore your peace of mind, your confidence, and your overall well-being. Before we dive into what happens when fluid is absent, let's quickly, and without technical jargon, review how this process should normally work. Imagine your body's reproductive system as a perfectly synchronized orchestra. The testes produce sperm. The seminal vesicles contribute the majority of nourishing, rich fluid. And the prostate adds protective fluid. This final cocktail is gathered and prepared in the urethra. When climax occurs, specific muscles contract in a powerful, rhythmic sequence to propel this mixture of fluid forward and out. It's a rapid event, the result of delicate and synchronized timing between nerves, glands, and muscles. So, here's a critical distinction, gentlemen. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure, governed by your brain and nervous system. Ejaculation is the physical act of expelling fluid. For most of your life, they occur perfectly as one event, but they are managed by separate mechanisms. Today, we're focusing on dry ejaculation. This is the technical term used when a man reaches orgasm, experiences the characteristic pleasure, but notices little to no fluid is expelled. It's often described to me in my office as an empty orgasm. This disconnect between expectation and reality causes distress, and I understand you have always expected the physical sign of this event. However, it's important to understand that your ability to experience pleasure can remain intact, governed by your nerves and brain. The changes involve the mechanical delivery system. This does not mean you have lost your masculinity. It simply means a part of your body's plumbing has a specific and identifiable reason for the change. Now, let's dive into the 3 most common causes of dry ejaculation. Knowing the cause is the first step toward feeling in control. The first reason is when the guard is too relaxed, known as retrograde ejaculation. This is the most common cause. Biologically, imagine a small muscular valve, a guard, at the exit of your bladder. During orgasm, this valve is supposed to close tightly, ensuring that seminal fluid has only one path, forward and out. If this valve is too relaxed, the fluid, following the path of least resistance, flows backward into the bladder. You experience the full pleasure of orgasm, but because the fluid doesn't exit, it appears dry. A practical clue is that your urine may appear cloudier immediately after intimacy, as the fluid has now mixed with it. Practically, this commonly happens after certain prostate or bladder surgeries. These procedures are successful and necessary, but can affect the delicate nerves that control this door. It's also a known side effect of certain medications used to treat conditions like high blood pressure or an enlarged prostate. The medication works on blood vessels but also relaxes this small muscular organ. I recall a patient, a very proud man, who was distraught after successful prostate surgery. When he understood it was purely a mechanical change, like a stuck-open traffic light, and that his desire and ability to experience pleasure were fully intact, he felt enormous relief. The second major cause is when the piping is blocked, or duct obstruction. Biologically, the seminal vesicles and other glands produce fluid normally. But imagine the small ducts as delivery pipes. If these pipes are blocked, the transport vehicle cannot pass. The volume drastically diminishes or disappears, even if production is normal. Practically, the causes for these blockages can include scar tissue left behind from past infections, such as severe untreated prostatitis. Rarely, small calcifications, like tiny stones, can form and block the passage. A practical clue is that symptoms can be subtle, but some men report a new, mild discomfort in the pelvic area during orgasm, or may have noticed fluid gradually becoming thicker and less abundant over a long period. The excellent news is that many of these obstructions can be cleared, often with medication to control inflammation, or, if necessary, minimally invasive procedures to restore normal flow. The third main area for exploration is hormonal factors, specifically low testosterone. Biologically, testosterone is the primary fuel for the male reproductive system. It not only regulates libido and sperm production, but is also critical for the optimal function of the prostate and seminal vesicles, which contribute the bulk of the fluid. When testosterone levels significantly drop, the entire system slows down. Emotionally, initially you might notice reduced fluid volume, but over time, this deficiency can manifest as reduced libido, less firm erections, and a general, less intense sensation of orgasm. On a broader level, men often experience fatigue, mood changes, and a loss of muscle mass. The practical solution is that this is often a condition called hypogonadism, a treatable hormonal insufficiency. If a simple blood test confirms deficiency, carefully managed hormone replacement therapy can often restore not only better fluid production, but also energy, desire, and overall quality of life. It's a mistake to simply attribute this to getting old. As in most cases, these causes are manageable. As your doctor, I must also discuss critical exceptions. Dry ejaculation can sometimes be a red flag for a more serious condition. This is why paying attention to accompanying symptoms is crucial. When should you seek help immediately? If dry ejaculation appears suddenly and without explanation, especially if accompanied by pain, blood in the urine, or fluid, fever, or loss of sensation in the genital area, do not wait. These are signs that require urgent urological evaluation. Conditions like some neurological diseases, long-term uncontrolled diabetes, or in rare cases, specific urological cancers, can interfere with normal function or nerve signals. The emotional impact is real. Beyond the physical, we cannot ignore the profound emotional toll this takes. Many men connect the presence of fluid with their performance and masculinity. When it disappears, feelings of inadequacy, anxiety, and frustration can take root. Men often start avoiding intimacy due to fear of being judged or feeling incomplete. Emotional reassurance is the most important step to breaking this cycle. Information and communication. Understanding that this is a physiological change, not a personal failure, lifts an immense burden. Your ability to experience pleasure, have erections, and enjoy connection is not solely dependent on fluid. Your intimate life can and should remain a source of joy. In conclusion, I want to leave you with a clear and supportive action plan to regain control. First, don't ignore, investigate. A sudden or progressive onset of dry ejaculation warrants a visit to a urologist. A simple medical history, physical examination, and often blood or urine tests are all that is needed for a clear diagnosis. Second, manage coexisting conditions. Keep chronic conditions like diabetes, high blood pressure, and cholesterol in check. They directly impact the vascular and nerve health that controls the entire process. Third, break the silence. Speak openly with your partner and your doctor. Discussing what you're feeling is liberating and opens the path to solutions. Remember, professional support, whether it's adjusting medications or specific treatments, is your best tool for restoring confidence. In closing, gentlemen, the absence of ejaculation is not the end of your intimate life or a verdict of lost masculinity. It is your body's signal, one that deserves to be heard and explored with a professional. Understanding the cause, whether it's mechanical, obstructive, or hormonal, is the first step toward finding peace of mind. I have seen countless men reclaim their confidence, vitality, and joy in life after receiving a clear diagnosis and a plan of action. Your vitality is not measured in milliliters of fluid, but in your health, well-being, and ability to live fully and connect deeply with others. Don't let doubt or shame prevent you from seeking answers. Acting in a timely manner can completely transform your experience, restoring the security and intimate connection you deserve. I'm Dr. James, and I'll see you in the next video.